Working in medicine has so many challenges, but I'd have to say one of the biggest challenges is probably when you transition roles, especially when you transition out of school and are a new provider and you are the one having to make all these decisions and have this weight and
Oh,
responsibility on your shoulders. But you also can have a lot of anxiety and a lot of difficulties and struggles when you transition from one specialty to another, or maybe you're transitioning from outpatient to like an inpatient setting. So today I'm interviewing a nurse practitioner, and she is going to share some of the tips and thoughts that she has that can help make your transition easier and really kind of just set you on a path for success in your new role. So, if this sounds good to you and you want to learn what these tips are and how to be as prepared as possible, then please stay tuned.
hi, I'm Dr. Noella C. West, and I am a doctoral prepared nurse practitioner. I've been in the healthcare business or service for about 20 years, and thanks for having me, Michelle.
You and I have talked previous to this, and we've talked about some of the struggles that people have in their career. And one of the big things that people have problems with is transitioning into a position. And so that's what we're going to dive into today. But first, tell us a little bit about your kind of career path and what it's been like for you in medicine.
I do have the nursing background. So I went to school, got my associate's degree, worked a little bit, had a family, got my bachelor's, my master's, my doctorate. And that kind of brought me to my advanced practice provider career as a nurse practitioner. So I've had a long journey and I've seen a lot.
What area of medicine do you work in?
I work in vascular neurology, so I'm all about the brain.
Why don't you talk about what you think are the common problems that you see new PAs and NPs struggling with, and or people who are just transitioning like different specialties?
Well, I think the main thing is the lack of role clarity because it varies from state to state and organization to organization. Regulatory barriers, workloads, all of those are still the same, no matter if you're a PA or a nurse practitioner. Of course, all of this can actually increase stress levels, taking care of patients, charting. All of this stuff can be just basically overwhelming. And a lot of times, this is people's second career or this is their new career in the healthcare field. So they're a novice as a new PA or MP, going from something that maybe they were an expert in. Maybe they were a banker or they were expert nurse or whatever the case is. So clinical skills, procedures, and things like that, like you've learned in school, can actually bring a little bit more anxiety because you're now a new provider. So you have that different role, a different mindset. So credentialing, privileging, all of that kind of stuff. So it can be very overwhelming at times.
It can be moving specialties, I think. Do you see that? Did you see that people have problems, when they're moving specialties or even just moving positions? Do people run into the same kind of problems?
Yeah, even though they may transition into a new NP or PA, that role alone is very difficult to kind of transition into. Not only that, but then you add on the layer of a specialty. So if you're in cardiac, if you're in neuro, if you're in mother baby or ortho, that is an additional specialty that you have to really learn and understand and form plans and standard of scope of practice.
Yeah, and we're talking about all this because it's so important, right? When people start a new position or a new job, it's so easy to get defeated or to feel defeated. And so not having that good transition or that good foundation when you first start can cause problems down the road and lead to earlier burnout. So it really is an important issue that we're talking about here. You're going to share with us some tips today, right, on how people can make their transitions a little easier.
There's three main things that no matter if you're a PA or either nurse practitioner, you're going to be struggling with these things. The number one struggle is navigating your scope of practice, understanding what that is. We'll go into depth about that. The second thing is building your confidence and just your clinical decision making. And then the third thing is time management and being efficient at your new role.
I'm not pointing fingers at anybody, but I know some people struggle with that last one a lot. We're going to start with the scope of practice. And I think scope of practice, some people may be like, well, duh, yeah, I know what scope of practice is. Other people may be like, I hear the term, but I don't really know what it means. So can you define it for us?
Yeah, sure. So basically, this means that any activities that you as a healthcare provider are actually permitted to perform. So this is under your training, this is under your education, this is under your experience. I know sometimes, for example, I've had new PAs or MPs working with me that I've been preceptor, that sometimes they don't feel comfortable in it. And they're afraid to even say anything, whether or not they're credentialed or privileged, or maybe they don't have enough skills that they've checked off. So, understanding what that means is very important. Working outside your scope can lead to errors. It can lead to your licensure. So you worked hard for it, so you want to make sure you keep it. So really understanding what that is, what the outcomes are, and don't be afraid, because believe me, I'd rather speak up now than in 2 or 3 years when I'm depositioned, and then I'm forced to actually talk to someone. So knowing your scope is
Right.
very important, and speaking up, they will respect that at the end.
There was some important stuff you said in there. One was what our scope is by law. That's
Mhm.
one thing. What our scope is by the institution or the practice that we work in. But the third part is our scope of what we've actually had some training in and what we feel comfortable with. So tell people, how do they actually understand exactly what their scope is from all of those different points of view?
Familiarize yourself with the laws and the regulations. Know what your state board or your certification body, what does that dictate? What does that look like? Because I may practice here in Florida, but then I travel over state lines to Georgia or North Carolina, and it can be totally different. So I need to
Yeah.
understand what that looks like. Seeking clarification and guidance from your supervising physician. What are their expectations? Me as a PA or NP, if I'm able to maybe do cryo in one area, maybe I can't do that in another organization. So understanding and clarifying what that looks like. And then lastly, just advocate for yourself and your expansions to practice within your scope and to your full licensure. Me as an MP, I know sometimes there's certain settings where they think we're glorified scribes, and we really aren't. We're actually advanced practice providers.
I like to get to really concrete information. So if probably the easiest place to start with scope is, like you said, the state boards. They can go online, right, to the
Mhm.
state, and they can find that by typing in nurse practitioner state board. And then there will be a list of guidelines there.
And
Yeah.
also, if you're already in specialized or you want to specialize, I would definitely highly recommend attending seminars, workshops, webinars that are focusing on that particular scope and those topics that you're interested in, because you never know what the nuances of regulation changes are. So that's always
Yeah.
very helpful just to keep abreast of that.
And then AANP and AAPA, the national organizations, you're saying that each of those should have similar listing.
Exactly. That should have regulatory initiatives on those websites. So that way you know what the state and the national levels are.
And then when people start working for an organization, especially like these larger hospitals, they're going to go through credentialing, and they're going to fill
Mhm.
out reams of paperwork that they're not going to remember. But what is really important in that paperwork? What tells them what they can do in that hospital? How do they know that?
Yeah, then they should really be looking at every single thing and know what the continuing education, what the training looks like, what the onboarding looks like, what opportunities that they have. And depending on whatever specialty that you're in, they may have their own set of protocols or either guidelines. So you need to ask those questions. Don't just assume.
I hate to implicate myself when I talk about things that I've done in my career and how stupid I've been, but it took me a while to realize in all of that mess of paperwork that I actually fill out a credentialing form that I mark what I feel comfortable doing and been trained to do. And they take that and they adjust it. And so people really should get a copy, the final copy of their credential form, right? Because it will actually list, like, it'll be checked off, like, you can do this, you can't do this,
Mhm.
those kind of things, right?
Yes, yes, and knowing
Yeah.
what that is, because I did that when I was a new NP. I had a basic credentialing packet, and I'm like, okay, I have no idea. I think I can do these skills, these privileging. Okay, but do I need 5 of these lumbar punctures in order for neuro, or do I need
Yeah.
something else for cardiology? So understand what, and reach out to your medical director of that particular specialty.
Okay.
They're willing to go over everything, what their expectations are. So yeah, don't be afraid at
Yeah.
all. Yeah.
And that's hard to do when you're just starting. You're so nervous. You're like, I don't want them to think I don't know what I'm doing and stuff. But like you said, it's important to get that ironed out, and important to know when you first start, because as you mentioned, you don't want to do something that gets you in trouble, right? Or that can
Right.
jeopardize your license. So is the scope like always just kind of set, and then that's it for the rest of the time you're there? Or are there ways that people can actually expand their scope in some areas?
There's really a way that you can actually change and expand. For instance, if you are with orthopedics, but now your practice now wants to expand the scope of an advanced practice provider. Now you need to give cortisol shots. So maybe you need to give injections and other things. So that might be something that you may need to look into, some additional training, what those training opportunities and education means. So your scope can actually change in that setting.
There's a lot of talk about scope of practice for PAs and NPs and how we're trying to expand our scope, which we're not really. We're just trying to get rid of some of the burdensome regulation that doesn't really change how we practice. We're still not, as you said, going to be able to practice outside of our training and outside of our knowledge.
I've always been a very positive proponent for advocating for any policies. And whether it's in your organization, state level, national level, being part of your own the organization, so that way we have a voice.
Yeah, even if you're not 100% excited about everything your organization does, or if you get frustrated with them, it's still the best places we have, I believe, are national organizations to be able to push things forward. National and state organizations.
Right.
Because the state organizations are in there working, like, really with the legislation in that state and getting the things passed. The second point that you had brought up of tips to be comfortable when you're transitioning into a new position is building confidence in the clinical decision making. We kind of touched on that a little bit in scope, but why don't you give us some examples of why this is important or some of the struggles that people may have or the problems it causes when you don't have that confidence?
Clinical decision making, when you're the actual provider, it gets to be a little intimidating. And really, we're as NPs and PAs, we're kind of learning on the job for a lot of things. We might have trained, we've done years and specialties and semesters, but when you get into the actual role, that's when everything starts kicking in. And of course, anxiety, that's normal. It's just like driving a car. I mean, until you get there, you're like, oh yeah, I'm hyped, but you really have to try to get that clinical experience. So my first advice is definitely looking at your exposure, getting in there. I know it's going to be hard. Ask the questions that you need. Expose yourself to different patient populations, the conditions, practice setting. Maybe I did all of my practice settings in an hospital, but not in the outpatient realm or not in the specialty realm. So maybe I need to actually do that as well. If I have any colleagues, embrace those opportunities because we really need to have that. Also, mentorship, guidance, residency. There's some institutes that actually have that, and there's some that are working on it. I know our institute actually has fellowships for NPs and PAs. So
Mhm.
it's very important that we're looking into that, especially when you're in your first job. Look at
Yeah.
those opportunities, take advantage of that. And then third, just your gradual autonomy. It's just going to take time. Decision making, knowing what you did. Back in the old school, I had a little flip book that I wrote my notes in, and I would go back to it. I would look at everything in Hippocrates or everything on my phone. Whatever is very important, I wanted to kind of write those down. And just don't beat yourself up. Positive feedback is important. Celebrate those little successes. Okay, yeah, I remember what this was. This drug is,
Yeah.
first generation for this or that. You know what I mean?
How do you think people get better at just flipping that switch of being the clinician, figuring out the decision making?
Yeah, a lot of times I do a lot of role playing. So I'm going to be the patient, you're going to be the provider, you're coming into the room, you're going to be delivering some sort of news, whether or not you're clarifying labs or telling what the plan of the day is, you're talking to the family. I'm going to be asking questions that your mom, that your dad would be asking. And I want you to practice, case scenarios, things that you might have done or as a new provider, like, hey, this happened the other day and now I didn't know what to say, but when I was with my supervising physician, this is what he said. However, I probably would have said it that way. Okay, well, why? Tell me why. Okay,
Yeah.
well, I know in the past this and that. And I'm like, well, there you go. You have that mindset. Feel free, do what you need. Support coping. This is something as a provider we need to do for one another.
There's a line of books, and they have them for family practice, but also for a couple other
Mhm.
just specialties, where they run through different scenarios and they talk through that clinical decision tree and what all that you're looking for. I think that those can be helpful for people who find that that's a weakness, is being able to come up with differentials and
Mhm.
deciding about why one way versus the other.
All that's helpful. Yes.
Any tips on how people can kind of make notes or organize things so they're not looking up the same thing over and over again?
Yeah, sure. So what I did, now this is just me, I could be anal, but I have my own little notes inside my phone, and I would organize them. And I would sometimes make up little sayings to myself. You know how you would learn your cranial
Yeah.
nerves, ooh, na 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 na. But
Yeah.
there were things that I would remember, okay, when it came to people who came in with clotting issues. I would think about scammers or something else. Okay, S stands for, okay, I need to make sure that I'm checking this. I need to make sure, for P, I'm making sure I'm checking PTTs, I'm checking INRs for so there's certain things that if you want to have your own little notes that gives you that, oh yeah, I remember this scenario previously and I remember I checked no 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 no. So having your notes and doing this often, even seeking out those type of patients. Hey, I remember this patient was on our list and I need to look at that. So the abbreviations, outcomes, any decision making that I've done that really helped, that caught something that I didn't know before, that I'm making that an actual note. Maybe I'm using that on my own template. Maybe I'm
Yeah.
using this for my notes. I'm having smart phrases or little templates that help. So
I like that the thought though of having your phone and just like voice dictating into a notes app or something, and then you can go back and organize it later. Because when I first started, I always thought at the end of the day I'd try to remember stuff, but you can't. So much has gone in and out of your brain at that point. So just when you walk out like of an office, or if you just finished a note or you looked up something, you learned it, just voice dictate it really quick, and then maybe once a week or something, you can compile that on an actual different document. Do you have particular resources that you think are very helpful? Like when you look up stuff, what do you tend to use most often?
I use Hippocrates a lot, and then I also use oh my God, what do I have a brain fart?
Not up to date. That's not what
Up,
you're.
yeah, yeah,
Yeah.
and we have the latest version, and then even with our electronic hospital record, they gives us other different resources.
I actually did a video, one of the first videos I did in this channel about using the free Hippocrates app and how people don't realize how powerful it is and how much you can do with it. I didn't even realize it until I sat down to research for that video. And so I'll put a little card up there if people want to check that out. That's going to kind of lead into, I think, kind of our time management and efficiency is what you said is the third key thing to get a handle on when you first start. So, what are some of the challenges that new providers face when it comes to time management?
Well, you definitely get behind. You're not taking lunch. You're not taking a bathroom break. You'll wind up working late, taking things home. Then you have stress at home. Then you have stress with your family. And then you can't do anything. And then your hair is falling out. You're not eating. You're gaining weight. So it's just a trickle effect.
So I will share. I share a lot on this channel, and I always put the caveat that I'm a good provider. My patients get good care and they love me, but there's some things I struggle with, and time management has always been one of them. So I'll give a good concrete example. When I started my first job, let's just say I didn't have a whole lot of mentoring on my rotations. I hardly got to chart in EMRs. Sometimes they were like, "Oh, well, we're just not going to get you access. Just we'll talk about things, whatever." So my charting was not the greatest. And so I go into family practice in a rural practice, seeing some complicated patients. And I'm writing novels. I summed up everything about that patient, which no one is ever going to read again because no one wants to read that much, right? And so I would get there at 7 in the morning, and I worked 10-hour days. So I would get there at 7 in the morning, and sometimes it'd be 9 o'clock at night, and I'm still sitting there charting, just
Oh my
crying, like
goodness.
this is ridiculous. And so I am here to say you got to get the time management. You got to get it
Yeah.
figured out because it will kill you in your career.
Yes.
Give us some tips on what you think are some of the best things to get a handle on, or to do when you first start working so you're not so overwhelmed.
The first number one thing is prioritizing, whatever that may be, prioritizing your tasks, prioritizing your patients. You have to know what's important. Tedious things will drag you down every single time. And then optimizing workflows. What is already existing? Is there something you need to tweak for yourself? Technology, using the dragon, using other things that's going to help, templates. And then whatever enhancing your collaboration. So say it's you and another PA or the NP. You're both seeing, the whole list of patients. Okay, I'm going to take these because these are going to be on this side of the wing, or this is going to be more complicated because you have family that's going to be talking. Okay, so maybe I'll see those first. So really just understanding what that looks like.
What are your favorite tips on being efficient for charting?
I like to actually look at the chart prior to even going in there. I like to look at the nurse's notes because I can find out if someone fell. I like to see dietary, maybe someone's NPO or maybe they're going for something. I like to see everybody's notes prior to actually going in there. So I do one of those chart checks, run down what's going on, write little notes, what's pending. That way, when I go into the room, I can say, hey, what's going on, do a quick assessment, and then let them know what the plan is. Along with that, I can tell them, okay, well, this test is pending, or this is what the result is. So, really not going in there blinded. So, I love to do an actual chart check prior, and I'll maybe start on a little template, do a little shell, go in there, see the patients. Once I'm done, I'll do some added. Okay, so this is what's pending. Go back and chart a little bit. That way, I'm not charting on everybody at the same time, but I'm doing a little here, a little there, and I'm writing my little notes. So I find that
Yeah.
helpful.
Providers have different thoughts on the pre-charting thing, and I think one of the biggest issues is that people may get mad, like, well, I pre-charted and then I had like 2 or 3 no-shows. Talking about like an outpatient. But I think that if I didn't try to do,
And
everything, just get a little familiar and get a few things in, get, like you said, maybe get a little something started, then that helps. And again, you're inpatient, so this may be different. Do you chart at all when you're with the patient?
no, I find myself focusing on the patient. I'm in and out because if I find myself in there charting, they're going to ask more questions. I'm going to be in there longer. Then that's going to drive my whole day behind schedule. So I would also want that attention. As you know, I don't know if you have, but I've been in doctor's office where they're dictating with their back behind me, or they're charting and they're not even looking up at me. So
Yeah.
it's like, okay, I'm just going to shut down or I'm going to get an attitude or something. So no, I just think it's a professional courtesy to have your full divided attention.
I totally agree with you when you said if you're in there charting an inpatient, because I tried to do that. And usually there's family in there and the patient. You're right. They start asking you all kinds of questions and talking about all kinds of stuff. Now, that can happen in outpatient too, but in inpatient, there's usually a lot more going on. And so those questions can spiral out of control. But I think that in outpatient, it's almost a necessity. But like you said, it's how you do it. There's always ways that you can be looking at the patient, even if you can't type while they're talking. Look at them, ask them the question, and tell the patient, okay, I want to get your words in so I know it exactly. So that tells the patient that they know you were listening, but you've
Yes.
got work to do and you need to get it in. So there's ways that it can be done.
Once they see that they can trust you, they'll be spilling out their whole guts. Oh
Yeah.
yeah, by the way, I do take this supplement that's not FDA approved. That's from China. You know what I mean?
When you talk about templates, do you use templates and dot phrases where you work?
Yes, both. I
Okay.
actually use
Yeah.
both, and there's some dot phrases that I created my own.
And just in case if somebody's watching this, they don't know what a dot phrase is,
Oh.
can you educate us a little bit about that?
So dot phrase is basically when you're on any type of computer, you're going to put a dot UTI, say. Once you hit dot, the letters UTI, it'll pull up something that you already set up with lab work that you need to be done, any follow up, a diet, whatever the case is. This is your own personal little phrase that helps you kind of chart better.
They are so very helpful. And in case people aren't aware, there are, especially if you work in like big hospital systems and stuff, there are tons of dot phrases already made that you can use, but you can also take those and modify them and make them your own as well and save it as something different. And so it's exactly personalized to you. Same thing with
Exactly.
your templates. That's another thing. I don't know if you see this a lot, but I I feel like IT is over here and then clinicians are over here and the two shall never meet except for those 2 days, 1 or 2 days that you get training when you first start, right? So I always advocate for that and think that the providers need to be better at developing a relationship with IT. And it may take some of your own time to go do it, but you may be able to get administrative time to sit down with them. They are so helpful, or they can be. Most of the time,
Yes.
they're very helpful. And they can help you get all that stuff set up. And if you don't even know where to start, they're a great resource.
Oh
Do you
yeah,
see
yeah.
that
I
too?
would, I would definitely have that. And matter of fact, there's some organizations, including ours, that actually have RNs or people with some sort of medical background who's also
Mhm.
on the IT, so they understand what the lingo is, or they
Right.
understand someone from pharmacy is on IT. So and if
Yeah.
you have that opportunity, be on these committees that incorporates those things because they'll
Yeah.
be so helpful.
So, any words of encouragement and final thoughts that you have?
You worked hard, you're here for a purpose. Do what is in your calling. If you feel something in your gut and in your heart that's right, do it. It's okay to be afraid. We're all learning. We're all inside this circle. I would rather find out and ask the question than to not. Michelle, you have this platform, and I really commend you for doing that. Because sometimes I'm Googling, okay, where can I find this? Well, what are other people doing? What's going on? So, the medicine couch is definitely a platform for all of us. So whether PA, NPs, we're still struggling the same. We still sometimes have our issues, but I think just hang in there. We can navigate this and we can all thrive. So thank you for having me.
And thank you so much for joining us today. Now, if you're a provider who's already practicing and you are thinking about changing specialties, but you're a little unsure how to prepare and how to be able to hit the ground running once you get into that specialty, I can help you out there. I've actually made a video about transitioning to medical specialties without having any experience in that specialty. If you're interested in that, I'll put that video here. And of course, you can always go to the playlist on my main channel page to find what you're interested in: non clinical jobs, cool and unusual jobs, or just what it's like to work in each different medical specialty. Thank you so much for joining me today. And as always, take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.